My child has a fever. What do I do?
Hi, I'm Jon Adamson. I'm a consultant in the emergency department at Birmingham Children's Hospital. I'm going to be talking about a very common symptom in children, which is fever. Fever, or a temperature above 38 degrees Celsius, is a normal reaction that your child's body will make to fight infection. Most infections in children, coughs, colds, sore ears and sore throats, are viruses which your child will cope with on their own, even in circumstances where they have high fever in children under 5. Often all they will need are plenty of fluids, some paracetamol for comfort if they're very hot or if they're in pain and unsettled, and plenty of rest. You can use ibuprofen if your child is weeing normally and hasn't been told that they shouldn't take it because of a kidney problem or other medical problem. Make sure your child doesn't have too many clothes on and isn't wrapped in blankets. We don't recommend measures like tepid sponging or using a fan to cool your child because we know most of these things don't work. It's quite normal for a toddler to get anywhere between 6 and 8 viral infections a year, which means over the winter many will have an illness like this as regularly as once a month. Most of these mild illnesses will not require antibiotics, but we recommend that your child is fully vaccinated, which will protect them against more serious infections such as meningitis. Your GP can arrange to have your child vaccinated if they've fallen behind. Remember, the thermometers we use in the ear are not recommended for small babies and may not be accurate in children up to 6 months of age. Likewise, the forehead thermometer strips are not really reliable in any children. In small babies, we recommend a simple electronic thermometer under the arm as the best way to take a temperature.
My 3-week-old baby has a temperature. Should I just give paracetamol?
You should always seek advice urgently from a healthcare professional if your baby is less than 3 months old and has a fever. At that age, the immune system is still immature, and until they're over 2 months of age, they will not have had even their first course of vaccinations. So at this age, it's important that they see a doctor if they have a fever.
Could my child have coronavirus?
We know that symptoms such as cough, fever, loss of smell, a rash, and sometimes an upset tummy can be caused by the coronavirus. The symptoms are similar to other viral illnesses, and in most children, they will get better on their own with the same measures mentioned above. So far, only a few children have become seriously unwell with the coronavirus. If your child does have these symptoms, you should follow the latest guidance with respect to isolation and testing, and these can be found on the government website. Remember to follow current government rules on isolation, social distancing, and always wash your hands regularly and thoroughly.
Doesn't fever mean my child has sepsis?
Luckily, sepsis in children is very rare. However, if your child has symptoms such as a seizure, their hands or feet feel cold or look mottled, they are very confused, lethargic, or if a baby is crying inconsolably, or you as a parent just think something is not quite right, your child should come to the emergency department. In addition, a rash that does not go away when you press on it, like shown here, is also a reason to bring your child to the emergency department straight away. You should check NHS 111 or call your GP if your child isn't taking fluids or weeing normally, or if they have a fever that lasts for more than 5 days. If your child hasn't been eating much, it's quite normal not to poo for a day or 2. You should seek advice if your child is over 5 and has a fever above 39 degrees Celsius, or if they have severe tummy pain, or if they have more painful or more frequent wheeze. For most children though, fever is a sign that they are fighting a viral infection, and if they are drinking, weeing normally, and they otherwise seem well to you, you can usually manage the illness at home, following the advice we've given in this video.